And here's this question. I've heard that Coolsculpting doesn't really work. I'm worried about spending a lot of money and not getting the results I'm after. Does it really work?
In my opinion, absolutely.
Well, mine too. But why? I suppose the deeper question is, why the negativity?
I don't know. I think it could be a whole bunch of reasons. There's a lot of copycat machines on the market that are cool something. So people think that because they're having that they're having Coolsculpting, and it's not. Our Coolsculpting machines are huge. They're so big. And the reason why they're so big is because they've got so much power to cool the tissues to the level that they need to actually kill off those fat cells. So there's a lot of copycat machines out there, and people think that they're having Coolsculpting, but they're maybe. And then there is a bunch of people that are having Coolsculpting and not getting the results. And then you have to question, is that down to poor assessment? Is it down to the fact that they've actually just put on weight and haven't maintained a healthy diet and have exercised? Because it's not a weight loss treatment, it's a sculpting treatment. So, and occasionally we do get people who come in and they think that we can just cheat the system. Like, well, I'll just have some Coolsculpting. And yeah, it will work to a point, but if you continue to eat poorly and not exercise, you won't maintain the results because the remaining fat cells will continue to enlarge. So you won't see great results. When someone comes into me, and I've only had it maybe once, if not twice, and said, oh, well, I don't really feel like it's worked that well. And then we have a look at the before pictures, and I'm like, and then they say to me, oh, but I have been on holiday and I have put on about 2 stone. And you think, well, actually, if you put on 2 stone and then you actually pinch the tissues, because this is a really good thing to do to check whether it's worked or not, is that, because quite often people look in the mirror every day, they don't remember 3 months before, and the number of times people have been shocked when you put their before and after picture together. But yeah, if you pinch the tissue where it's been treated, so say you treat an inner thigh, so we're talking about inner thighs, if you pinch the area that's been treated, the pinch thickness is always so much less than in the treated area. So you can see that way that it's definitely worked. That person might not feel it's worked to look at because they've maybe put weight on round about it. So there's lots of different reasons, I think, why people...
Yeah. I totally agree with all of that. So unfortunately, again, absolutely not mentioning names, but we are unfortunately cursed with a nearby, not so far clinic that uses fat freezing that isn't Coolsculpting. And they are very, 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 very low prices. So patients will try that. It inevitably will be unsuccessful. And actually, it turns out that Coolsculpting was really a good option for them. They're just begging to have this treatment, but they've already wasted money on something that wasn't ever going to work. And it's such a battle to overcome, to persuade them that you know, to try again with something.
They've lost they've
lost faith.
They've lost faith, and quite a lot of the time with other machines is that it cools tissues, because that's obviously what the machine's designed to do, but it just doesn't cool them enough. So they might get a little bit of temporary improvement, but they haven't killed off the fat cells, not gone permanently. And then when they resume their normal lifestyle, then they just notice it gradually sort of...
Whereas Coolsculpting kills them permanent. Well, like I say, the other thing is, I really think, and you won't say this because you're too modest, but I think it's very operator dependent.
Yes,
you talked about
definitely.
You talked about assessment, and I think there's a lot to do with it. And I see results that seem to exceed those, you know, even other genuine Coolsculpting results, and I think they're great. I think you do incredibly well. I think you do it really, really well. The assessment's good. And also knowing when to say no, and actually say that,
Jenna says no quite a lot.
And you do. You decline work, which
I think that's a good thing. It's a good thing
for the benefit of patients.
Sell.
We don't do that. For the benefit of patients, you'll sort of say, actually, you're not in the best position to have this done. And there was this guy who, I'm sure you know who I'm talking about, Russian fella, who you'd sort of assessed for potentially 30-something areas of Coolsculpting. To which said, we don't even have a price for 30-something areas of Coolsculpting, and it just wasn't the right treatment. And very rightly, you deterred him and put him on the right track with diet and exercise and other things. And I'll always remember, you sort of came about a year later, you sort of knocked on my door and you said, guess who's back? And you told me this guy. It's like, how is he? And he
person
said,
he wasn't the year before.
and it said, how is he doing? And you went, he's really handsome. He'd lost all this weight and was just really, you know, and sure, had, I don't know, 4 or 6 cycles of Coolsculpting.
He only had 2 cycles in the
Oh,
end.
right, okay.
He went from 20, I think it was 28, is what I originally quoted him, and he had 2 in the end, just lower tummy, just to get rid of that last little stubborn pocket that wouldn't shift.
Yeah, amazing.
You must touch base with him. And
yeah, actually, yeah. He's brilliant. He's a great character.
Yeah, definitely.
He came in with his wife.
Yeah, she's lovely.
Yeah, indeed.
Yeah.
Ah, right. So yeah, and the other thing just to mention on the whole Coolsculpting front is our policy, which is that we've said that if someone were to have Coolsculpting, because I think because there's that negativity out there, which we're just so keen to dispel, but because there is, we've said if someone has a Coolsculpting treatment with us and they haven't put on weight and they don't see a difference, then we will refund or give them or retreat for free. And we've never had to do that, which is amazing. And if they have a treatment which gives, you know, a response, but maybe a bit less than we would have expected and that they would have expected, then we will discount their next one by 50%. So hopefully that just gives people confidence that we really believe in this. We wouldn't do that if we didn't believe in it.
So we haven't had any patients that haven't been happy with the results.
Yeah.
They've all
it is amazing. Sorry.
No, just saying they've all had great results. So we've not had anyone really who's come back and not been happy.
I had to say that I think that's probably testament to your selection as well, because, you know, if patients aren't right, but you were to just plow on anyway, then they wouldn't get a good result. They would be unhappy. So you just got to come. It's a free assessment, isn't it? So it's, you know, hey, why wouldn't you?
As well, like the assessment is really important. It normally takes a good 45 minutes, an hour to go through a Coolsculpting consultation. I think it's really important to know all the information beforehand. It makes it so much easier then when you come in and have treatment and you know what to expect. But the assessment bit's really important, making sure that you've got the right applicators, that you've got, and if I'm not sure, I'll get the actual applicators out, I'll stick on the machine and make sure that I can put the applicator on. So yeah, so I allow plenty of time to make sure that it's right going ahead.
Yeah, absolutely.